Welcome to Prevention Institute's webinar titled Preventing Trauma and Youth Suicide During COVID-19 and Beyond, Promoting Youth Mental Wellbeing Through In-School and Out-of-School Supports. This webinar is part of a project supported by a cooperative agreement with the Centers for Disease Control and Prevention. The views and information provided here do not necessarily represent the official views of the Department of Health and Human Services, the CDC, or Prevention Institute. So as we dive into today's conversation, please feel free to use the text chat to join in, as many of you are already doing. We're going to continue that right now with an initial question to reflect on. Let us know what's been top of mind for you when thinking about the well-being of young people during COVID-19. Let us know in the text chat, and we'll circle back in a minute to hear what's coming up. So during today's session, we want to talk about the impact of COVID-19 on school-aged youth, how agencies and organizations are responding, and roles for local partners. We also want to look ahead to what we can do and change now that will support well-being in the long term. We'll start with a little bit of context, and then we'll move into conversations with specific panelists about their work before coming back together for a joint Q&A. We may not be able to answer all the questions you submit in this hour and 30 minutes, but we hope it can spark ideas and actions moving forward. So let's turn back and see what's been top of mind for you in terms of youth mental health during COVID-19.
Yeah, thanks, Alexis. There's a lot coming up there. A lot of people are talking about isolation and thinking about home environments and housing stability, food insecurity, family dynamics. But I would say isolation, social isolation, and support is really coming up a lot.
Thanks, Alicia. And a lot of that, many of those thoughts, and particularly the comments around social isolation, I think connect really well with our panelists' work and what they'll be sharing with us shortly. And a lot of those responses also help make the case that young people are an important group to focus on in preventing trauma and suicide. In 2018, suicide was the second leading cause of death for people between the ages of 10 to 29 in the US. And there's been an upward trend in suicide rates among persons aged 10 to 24 over the last decade. Moreover, economic downturns are associated with increased mental health problems for youth, and this may be connected to the downturn's effect on adult unemployment, adult mental health, and child maltreatment. And studies are showing that COVID-19 is tied to poorer parent and child mental health. Many youth are experiencing disruption to their schooling, healthcare, and routines, the suspension of in-person activities and significant life events, and loss of economic security and safety. And many of us on the call are facing these challenges in different ways within our families and communities. So as we think about needs and solutions, it's also important to recognize that suicide does not affect all youth to the same degree, and this was true before the onset of the pandemic. Lesbian, gay, and bisexual students have increased risk of suicide thoughts and attempts. And in December 2019, the Congressional Black Caucus issued a report showing escalating suicide attempts among Black youth. And the highest rates of suicide are among non-Hispanic, American Indian, and Alaska Natives. As you can see in the graph, the suicide rate for this population increases steeply during childhood and adolescence. The challenges associated with the ongoing pandemic have also disproportionately burdened some youth and communities. Youth experiencing homelessness, justice-involved youth, rural populations, youth with disabilities, youth in foster care, and English language learners are some subgroups at risk that require a focused response. And we know that there are other groups too, so feel free to share in the chat other groups that you may be working with. So leaders and communities across the country are adapting to the current context, while at the same time, doubling down on efforts to promote well-being and prevent suicide. Importantly, this includes efforts to prevent adverse childhood experiences, or ACEs, one of the upstream factors shown to increase risk of suicide. A number of the strategies to prevent ACEs and suicide overlap. And some of the strategies and approaches we'll be talking about today include promoting connectedness, including through caring adults and activities, peer norms programs and community engagement, and teaching coping and problem-solving skills such as through social emotional learning, and finally creating protective environments, including through organizational policies and culture. We're pleased to have the opportunity to talk with several groups on the web conference today from across the country that are advancing youth mental well-being in different ways. We have Gianna Rocha from the Brighton City Youth Commission and the Youth Education and Families Council of the National League of Cities, Elizabeth Stranzel from the Division of School Climate and Wellness at the New York City Department of Education, Sharifa Charles from the Center for School Behavioral Health at Mental Health America, Greater Houston, Arya Nandyal of Broomfield Youth for Youth, and Nicole Dolan from Broomfield Public Health, and Dr. Nia West Bay from the Center for Law and Social Policy. And Alicia is going to start us off with our first panelist.
Thank you, Alexis. And I just want to do a quick sound check. Gianna, are you able to unmute yourself?
I believe so. Can you guys hear me all right?
Yeah, I can hear you. Thank you for being our first guest today. Gianna is a junior in high school and a youth representative, both locally in Brighton, Colorado, and also for the National League of Cities. So Gianna, you've been part of local violence prevention work in Brighton for several years, and would love to hear from you. Why did you decide to get involved?
Yeah, of course. So I'd just like to begin by thanking everyone here for all of their work surrounding suicide prevention and mental health awareness. It means so much to me to be speaking on a platform here with you all today about something I'm so very passionate about. I started getting involved in my community at the end of my 7th grade year, and it wasn't until then that I felt like I had a true purpose. My passion for authentic youth engagement and struggles with my own mental health are really what made me fall in love with SPEAK. For those of you who don't know, SPEAK is a suicide prevention project that stands for Suicide Prevention, Education, Awareness, and Knowledge. SPEAK started back in 2013 in my hometown of Brighton, Colorado by the Brighton Youth Commission. SPEAK Week is a week worth of education and breaking down stigmas surrounding mental health. It's implemented in local schools, and at the end of the week, we hold a 5K walk at a local community park to hold and raise community awareness. When I started volunteering with SPEAK, I was so young and still had a lot to learn. And it wasn't until then, with my involvement with SPEAK, that I was told by an adult that it's okay to not be okay. As a young person with such an impressionable mind, I honestly think my life would be extremely different if I had never had that support. One of my main beliefs is that no one should ever feel alone. And with SPEAK, I feel like I'm making a difference in making sure that everyone feels supported and that no one feels alone.
Wow, Gianna, thank you so much for sharing that with us. Really appreciate it. And for introducing us a little bit to SPEAK. Would you like to tell us more about SPEAK and your local work and what's really been coming up in the current context?
Yeah, of course. So over the last 4 years with SPEAK, I've gained so much experience, skills, and friends that have really made this whole process extremely rewarding. SPEAK has allowed me to connect with so much of my community and has helped me grow so much as a person. The skills I've acquired will be extremely beneficial in all aspects of my future. Now, I know almost all the ins and outs of SPEAK and have worked so hard on this project that sometimes I can lose sight at the end goal. But on the day of the walk or the week of the event, it all pays off. During SPEAK Week, we ask students to wear yellow on the last day of the week or wear a SPEAK shirt. And as a high school student who often feels disconnected with other students, seeing my fellow classmates do something as simple as wear a SPEAK shirt makes me feel like we're all fighting for the same cause. It reminds me that what we are doing is so very important. I remember my very first SPEAK Week. It was my 7th grade year and no one really knew what SPEAK was. I was so passionate about the program. I broke the school dress code to wear the SPEAK shirt. Mind you, I went to a private school where we wore uniforms. I had good intent and I'd asked the principal beforehand. And when I asked him, he seemed kind of hesitant and didn't really give me a clear yes. So on the last day of SPEAK Week, I wore my SPEAK shirt. I wore it with confidence and I never got in trouble. Now, I'm not saying you should break the rules to get your point across. I'm just saying I'm a firm believer in fighting for what you believe in. My grandfather always says, "How does the turtle cross the road?" Well, he starts by sticking his neck out. meaning that you have, in order to get somewhere, you have to start somewhere, even if it may be a little risky. Then wearing the Speak shirt wasn't something that was encouraged, as opposed to now the schools and students love Speak. Now as a junior in high school, students reach out to me and ask me things like, hey, when is Speak Week happening? Or how can I get involved? I could sit here and throw a bunch of numbers at you on how Speak has impacted our community, but I feel one of the biggest impacts Speak brings is the advocates that comes from it. Over the past 4 years, I've witnessed a community completely embrace mental health awareness, especially regarding youth, and become champions for it.
Wow, that's amazing. It really sounds like there's been a culture change that's happened through the work that you're doing, and I'm really glad to see that youth voices are leading it. And a lot of our participants today are also saying that in the chat. There's so many positive words thanking you for your work, saying it's giving them chills. So thank you for sharing about the local work. And I know that you're not only doing local work, but you're also engaging at a national level. So can you share a little bit about how you're bringing what you're learning locally and really applying that nationally through the National League of Cities?
Of course. As a youth representative on the YEF Council, I've been presented with so many opportunities, and I've had the chance to share Speak on a national level. Being on the YEF Council with other youth and elected officials allows me to bring a unique perspective and address issues impacting our youth. As well as being on the YEF Council, I'm on the NLC Planning Committee for the Youth Track. In this committee, myself as well as 14 others are planning workshops for the Youth Track at the conference. One of the workshops I'm helping plan, along with 2 other youth representatives from Brighton, is a mental health awareness workshop. In this workshop, we're going to present on Speak Week and lead our attendees through a process of planning their own suicide prevention projects. We plan to help spread awareness and give our attendees tools to take back to their communities to help break down stigmas surrounding mental health and suicide prevention. The conference is November 19th through the 20th, and our workshop will be Thursday, the 19th at 9 a.m. Mountain Time and 11 a.m. Eastern Time. We would absolutely love it if you can make it. It has honestly been such an honor to be able to share Speak with so many people, and it's kind of full circle. Last year, I attended the San Antonio City Summit with my youth council. One of the first things and the activities that we were asked to do was to write on a big piece of paper something that we'd love to do in our city. The first thing that came to all of our minds was Speak. We drew the acronym on the poster and took a picture with it. I think it's actually on the slides. We all have our faces around the picture. It's kind of cute. You can see how excited we are about the project, and it just means so much to me. To fast forward to now, we're at the same conference, planning the conference, and planning a workshop on Speak. It means so much to me to be here with you all today, leading our way towards change and making a difference in the world. I couldn't thank you enough for having me today.
Thanks, Gianna. That was great. And I'm really excited to circle back with you after the conference to really hear more about what's coming up for other young people right now in the COVID context and what kind of activities are really going to come out of this. So thanks for giving us a sneak peek, and hopefully we can come back later on too.
Of course. Thank you so much for having me. It's been an honor.
Yeah. So we will invite Gianna back at the end when we bring all of our panelists back. But next, I'd like to introduce Elizabeth. And Elizabeth, can we do a quick sound check?
Hi, everyone. Good afternoon.
Thank you. So Elizabeth is the Director of Policy in the Division of School Climate and Wellness at the New York City Department of Education. And Elizabeth, I would love if you can share about the thoughtful Bridge to School plan that New York City has created that really focuses on resilience for the 2020-2021 school year. So what's this plan all about, and why did you create it? And everyone, we will be putting the link to it in the chat.
Thank you, and good afternoon, colleagues. I'm honored to be here representing the division under the leadership of Deputy Chancellor Robinson, and really honored to follow Gianna. I'm always inspired to be in the presence of strong student leaders. Thank you, Gianna, for kicking it off. It's a hard act to follow. I'd love to talk about the Bridge to School plan. So, like many of you, when schools first switched to remote learning, our immediate focus was just how to support schools with what they needed right away. So resources for crisis response, technology, access to instruction, and to ensure they could continue prioritizing social and emotional wellness. And We did this to continue the foundational work that we were already doing in schools through our supportive environment framework and through social emotional learning programs like Ruler, Stanford Harmony, restorative practices, etc. So the immediate was like, just how do you stabilize? But very quickly after that, once we had the basic supports that schools needed in place, we pivoted to thinking about what are schools going to need for reopening. And as early as April, started engaging with community-based organizations, advocate groups, partners within the Department of Education to think about how do we meet the needs of students, families, and educators? And what should our preparation look like from now until September? And what does reopening look like? So from the very big ideas to the very granular, like what exactly happens on day one? My daughter is a New York City DOE student, and I'm thinking about when she first goes back to a classroom, like, what does that look like? What's happening? And I wanted her to have a classroom teacher that was prepared to welcome her in a supportive way. And I wanted that along with my colleagues for all of our 1.1 million students. And so through generous private donations, we were able to partner with a program at the University of Chicago to do some trauma work and to do some professional learning. And then we created the Bridge to School plan as kind of the complement to that. So we started by focusing on capacity building with adults around just basic principles of trauma-informed care and healing-centered schools. And then the Bridge to School plan was kind of the application. So how do we take that learning and put that into practice? We wanted schools to have a practical and age-appropriate resource to support students and adults as early as day one. So I'm going to walk us through a little bit of what's included in there. And you can follow along at home right now, or you can follow along later. I'll give you just kind of the big ideas and highlight a couple of things. So this is intended to be a resource guide to support school leaders and school staff with very practical strategies, resources, and ideas for how to care for the wellness, not only of adults, but for students as well. And this is really our response to feedback from so many individuals saying, you can't reopen schools like nothing happened. We need a different start to school. We need reopening to look different, and we need that work to last beyond the reopening. So as far as the big picture, the Bridge to School plan is organized around two key themes, which are community and resilience. Community was right away a choice for us because we need everyone to be involved in the work. This is not just the work of educators. It is not just the work of the school leader or the school counselor. A school counselor or social worker cannot single-handedly lead a crisis response following the last school year that we've had. Literally every single person who interacts with students needs to see a place for themselves in this. And so we centered this Bridge to School plan on community for that reason. And the theme of resilience was also really important to us, particularly as it relates to our anti-racist values. So there can be a tendency in trauma work, even with the best of intentions, to view students through a deficit lens or overemphasize what happened to them, as opposed to what they're capable of. And we really wanted to anchor ourselves in acknowledging the strengths and assets and resources that children and communities bring to the healing journey, and not just what they've been through. So it was important for us to land there on those themes, and then we built out activities from there. So the document starts with some framing from the New York City's First Lady, and then some discussion around family and community engagement, some considerations for, if we're doing this through remote learning or blended learning. And then on page 10, we have a section that's just for adult social and emotional learning. We really needed to make clear that our adults are not just there to serve students, that is their job, but they're also people too. These are human beings who have experienced the same 2020, and some with incredible loss and hardship that our students have, and how are we caring for them so that they can care for children. So that was a really important starting place for us. And then on page 11, it starts with age-specific sections. So we have resources for early childhood, K through 5, 6 through 8, and high school, as literally as granular as day one, week one, what can we do? And none of this is mandatory. It's a resource. Some of our schools already had a lot of infrastructure around social emotional learning to start with. So for them, Bridge to School is like a supplement. We have other schools that didn't have as much to work with, and for them, it's been more of a robust support. So following a lot of activities and resources for staff members, we close with some support supporting sections around stakeholder engagement, some additional resources, and then previewing the work long-term. So the reopening of school through the bridge to school, like we need a bridge to school. Our reopening needed to look different, but this work doesn't expire like a month in. This is work for the whole school year and beyond that. And so we embedded also a lot of resources that could sustain a school beyond their first few weeks. So I know that was a lot to cover. You'll of course need to unpack this, on your own time, but just offering that as wanted to highlight some of the key pieces that are in there and a little bit of how we were thinking about going about the work.
Yeah, thank you, Elizabeth. And we're already getting comments in the chat, things like this would be great for schools, communities in rural areas even though I know New York City is the opposite of that, but so much application in lots of locales to learn from this. And then also I wanted to say, top of mind when it comes to right now, usually people just think about COVID safety, and it's really important to be thinking about community and resilience and social emotional learning. And these are things that are in the CDC's technical package, both for suicide prevention and ACEs prevention. So glad that there's attention to those kinds of things right now. And I really appreciate how you kind of outlined the different sections. I'm wondering if you can share more about the parent and student engagement section.
Sure. Yeah. So as I mentioned, with our focus on community, we know that we need to do this work together. We need our families, and rather than start the year off with formal assessments or assumptions about the experiences that our students might have, we want to leverage families as partners to say, tell us from your perspective how you experienced the past school year. Tell us from your perspective what your child may need. A lot of the attention in mental health conversations has been around the COVID pandemic, understandably so, but we also have a lot of students and adults that are suffering and really struggling because of recent attention on longstanding racial injustice. And we need families, we need their support and their insight to really know what their students need and to be able to engage them as meaningful partners. What worked for you last school year with remote learning? What didn't work for you? What do you feel like your child needs? And so what we offer at the beginning, I think it's on around page 6, is some guided questions for adults that can engage with families to, yield information in a more personal way. And then also offering the recommendation that you need to have a structured communications plan. You need to think about these things strategically. Like there's the personal element of just what do I ask and how do I engage? And then there's a structural element of what systems do I have in place to make sure that I'm inviting families in this way. My daughter, changed schools from last year to this year, and both of her schools were great at communication. They did it totally differently. So it's going to look different in different places, but it needs to be thoughtful and proactive, and it needs to be two-way. Like I appreciate updates from the school, but I also appreciate being invited in and being able to say, here's what might work, here's what she needs, here's what I think others need, and here's how I can help. So that was important for us.
Yeah, and we're getting some agreement in the chat. Open discussion with parents in the school can help bridge a gap in communications, for sure.
Really.
If we go to our next slide, we actually have a discussion question for the audience. We are wondering if in your community, what non-traditional partners you've engaged with and how. And the reason that we're wanting to know about this is because part of the Bridge to School plan includes a section on engaging different stakeholders and including, borough citywide offices, parent associations, wellness councils, community-based organizations. And Elizabeth, would love to hear from you about, why did you decide to include recommendations on these types of partnerships as part of the plan? And what role do you really see for different partners to play in supporting children's well-being?
Yeah, that's a great question. So I think the first and one of the biggest reasons we thought to include it is just because community-based organizations in particular have tremendous expertise and knowledge and passion and a real genuine interest in serving. And many of them have been supporting our schools and our communities with mental health work long before COVID or any of the other events that have transpired in the past school year. And when we were creating the Bridge to School plan, that was not just the work of a few central offices. We, like our connection to the trauma provider, for example, came from an advocate group. The shift to being focused on healing centered in addition to just trauma informed, that was a recommendation from a consultant that an advocate community connected us to. So they have tremendous experience and knowledge. I mean, that's many of you represented here on the call, you know this is your work. And I think they can offer a level of clinical expertise and resources that school-based staff may just not have. And also, in addition to that, like schools need help, and school leaders in particular cannot be the holder of this information on their own. They're having to be the holder of physical health and safety and attendance and learning and all the other things that are involved in school leadership long before we were in these current circumstances. And so having a distributed leadership model and leveraging the assets of these various stakeholders is really the only way to sustain the work. So it's thinking about what are the specific skill sets and resources that each of these stakeholder groups offer that we can leverage. So like school wellness councils, for example, those are in-house, it's an in-house structure where we're leveraging teacher leaders, counselors, behavioral staff who can, suggest strategies or activities. You're leveraging families for more of a community perspective and, to be inclusive. So each of these groups plays a different role. It's just about being aware of who's available as a resource. We highlighted some of the key stakeholders. It's certainly not an exhaustive list, but wanted to, like students, that's a huge one. Imagine if, we had speak in all of our schools. Imagine if we all had student leaders like Gianna, and that potential is there if we tap into it. And so we wanted to name for leaders like, this is important work. We know that it can be a lot, but there's absolutely no reason to feel like you need to do it alone.
Great. Thank you so much for sharing today, and we'll bring Elizabeth back at the end as well. Just to share out from the text chat, lots of people have been mentioning other types of partners that they've been engaged with as well, which includes, community-based organizations. We heard someone say food banks, young people, Native American student task force, mental health organizations, foster care, lots of different groups. So I'm glad that people are already thinking about diverse partnerships in their work. So I am going to now hand it back to Alexis to take us to our next panelist. And thank you again, Elizabeth.
Thank you so much.
All right, thank you, Alicia and Elizabeth and Gianna. Up next, we're excited to have Sharifa Charles join us from the Center for School Behavioral Health at Mental Health America Greater Houston. And in addition to her work in Houston, Sharifa has also been deployed to communities like Bay County, Florida, and the U.S. Virgin Islands following hurricanes, where she's provided trainings to counselors and first responders. So she brings that experience and lens to the current pandemic situation. Sharifa, can you tell us a little bit about MHA more broadly and the Center for School Behavioral Health, and also how your work has shifted to be responsive to the current context?
Absolutely. Good afternoon, everyone. It's an absolute pleasure to be here. On behalf of the center, we are excited to be here with Prevention Institute and every single one of you that's on the call. Just to let you all know a little bit about MHA, Mental Health America of Greater Houston is the area's longest serving mental health education and advocacy organization. And we focus on shaping the mental health of diverse people and communities, including in the areas of children, education, and suicide prevention. As you all know, I sit on a smaller team called the Center for School Behavioral Health. We affectionately call it the Center, and we incubate innovative, cost-effective, and reputable, you know the word, best practices. I don't know why I'm stumbling. Best practices to improve the behavioral health of students. So we primarily focus on schools. As far as how we've shifted to respond to the current context, one of the things I would like to start with is talking about Emotional Backpack Project, which is our flagship training initiative. It comprises of 5 training modules and utilizes a train the trainer format. We have primarily and successfully implemented in 20+ charter and school districts in the Greater Houston area. 2 emotional backpack facilitators are chosen from each school within a district and receive training on youth mental health signs and symptoms, trauma-informed classroom strategies, suicide prevention, and self-care for the educators. And those modules can be given, they can go back and train school staff, students, and parents. Traditionally, this has been done in person, but in response to COVID-19, we have converted all modules and training materials so that they can be effectively facilitated virtually. Also, in response to the emergence of coronavirus, the center has created 4 virtual trainings, which are still accessible via our website that relate to COVID-19 and mental health. Some focus areas are the needs of guardians and caregivers, exploring the impact of mass media on mental health during a pandemic.
Thanks so much, Sharifa. I really appreciate the model of sort of embedding in the school system, which kind of increases sustainability. And also just the piece around incorporating self-care for the adults who have touch points with youth.
Yes, absolutely. We definitely advocate for the adults taking very good care of themselves. We all know that the mental health of any youth-facing adult on the campus will directly affect the mental health of the students.
Absolutely. And can you say a little bit more about the role that culturally responsive supports play in the work of the center?
Yes, absolutely. One of the first action steps that we took, now that, we all are advocates for cultural responsiveness, but as we know, it's definitely under, the nation and all of us serving different populations, there's more of a spotlight. The first action step that we took as a team was to revamp all the current trainings that we have to make sure that they're more culturally competent and to explore and teach related skills to any school-based youth-facing adult. For example, classroom educators, school-based mental health professionals, and even law enforcement. We definitely don't think it should sit with just one, depending on your role. We think that you have to make sure that every adult that is interacting with a young person has those skills. And this is in addition to it being evidence-based and ensuring that new content meets the needs, the specific needs and unique needs of the youth of our diverse city. We also, as you have mentioned, we've had wonderful opportunities to collaborate with such organizations like UNICEF, the CDC, CSTE, and even the US Virgin Islands Department of Health. We had an opportunity following natural disasters, as you know, 2 terrible hurricanes, I should say actually 3 terrible hurricanes. We went and we were able to do trauma trainings in Puerto Rico. I wasn't able to do it myself, unfortunately, but the team definitely represented. And also we were able to go to the United States Virgin Islands, which I call home. I was born in St. Croix, and we did trainings for first responders, particularly with a focus and a lens looking at youth in St. Croix and St. Thomas.
And I can imagine that has sort of a number of takeaways that you would bring into the work that you're doing now. And, we talked at the beginning of the call about a couple of subgroups that are disproportionately impacted by some of these issues. And you have experience on Houston's citywide implicit bias initiative as a core planning member, addressing the disproportionality with which students of color are disciplined and incarcerated in the city of Houston. And so we're wanting to hear more from you about how your work at the center impacts some of the subpopulations that we touched on earlier, such as justice-involved youth.
Yes, absolutely. The center is deeply committed to ensuring that we have a special focus on many of the vulnerable populations that we're all aware of, right? You mentioned quite a few of them. As you also mentioned, Alexis, I am a proud member of the core planning group for the citywide implicit bias initiative. And we are at around 1.5 years. The first year, we definitely spent time working in groups to identify the areas in the city of Houston that we wanted to focus on. And now we're really looking to putting things into action. So whether that's on a policy level or looking at mandatory trainings for educators, that's something that we're definitely exploring. And this is just simply a part of the center's belief in really trying to interrupt that that school to prison or deportation pipeline that we all know exists. We've also explored different ways outside, so in not always external, but looking internally. So for our 5th annual conference that took place 2 weeks ago, we had for the first time a school resource panel where we talked with school resource officers about their trauma-informed practices and some of the ways that they are in unique positions to impact the effects of what's happening in the world on young people, as well as how they become a part of the justice system. We also host policy symposiums where we bring a lot of our school districts together to really go through their code of conduct and other policies that might not be equitable and maybe driving some of these disproportionate rates. And again, at the annual conference, we talked to many leaders in different entities all over the city of Houston to talk about their place in the conversation about equity and about justice and how all of us play a part in that pipeline. And so how do we address what we're doing to ensure that we are interrupting that? And also, as things continue with the work that we're doing, we just really are trying to make sure that we're using an equity lens throughout our trainings and our services. We're also helping our counterparts, since we have a very unique target population with our school districts. We are also able to really drive that agenda within our organization and kind of making it contagious and making sure that all of us are examining the services that we are providing our population in Houston.
Thanks, Sharifa. I really appreciate that, the work you're doing is both kind of immediately responding to students' needs right now and the needs of adults who work with students, but also you have this overlay of kind of the long-term view of how do we change systems and how do we affect organizational practice change and culture change with other agencies and sectors that we might work with. So thank you so much for sharing, and don't go away. We're gonna get back to the joint Q&A in a little bit. We're next I'm gonna hand it off to Alicia, but I think first we have Arya and Nicole. Arya Nandial is from Broomfield Youth for Youth. He's a teen advisor, and Nicole Dolan is with Broomfield Public Health. Arya and Nicole, can you tell us a little bit about Broomfield Youth for Youth and why you decided to get involved?
Sure. So Broomfield Youth for Youth was established in 2018, and it's a group of local middle school and high school students who collaborate with Communities That Care, which is like an adult coalition, and we provide a youth voice for that coalition. Our group is mainly focused on youth substance use prevention, improved well-being, and forming positive relationships. And some of the outreach we do is through our Instagram, Broomfield Youth for Youth, or Y4Y. And we also have a COVID resources page that we have been spreading throughout this pandemic. As for like how I got involved, I've always loved to help in the community. It always brings me joy to just see like happiness on the face of others. So that's like one of the biggest things. And I was looking for an organization that I could join. It was after my freshman year, and I had some friends already part of this organization. So I thought it'd be a great opportunity. And since then, it's been amazing just being able to work with people who are also have this like kind of driven mindset to make a change in their community. And it's a really open and welcoming place where we see change and we're able to do as much as we can, which is something I really love.
Yeah, exactly. Just to expand a little bit on what Arya had said. So Youth for Youth is part of Communities That Care, CTC, and it is a 5-year effort. It is a youth substance abuse prevention initiative that we have taken part in now in Broomfield. We're going into our 5th year. It is what we have found in Broomfield works really well is these community-based programs like Communities That Care, where we can, it gives us opportunities to partner with various organizations in our community and the youth. So On our Communities That Care Coalition, we have members from youth serving organizations, we have city council members, we have nonprofits, we have faith-based organizations, we have administration from various school districts. So it's a great place for all of us to connect and support each other. I think, Elizabeth had mentioned it's a community effort. And so Communities That Care has really allowed us a place to all collaborate, and we have a strong representation on that coalition of youth. And we always say that youth are the experts, and so we really try to listen to them as they advise our CTC coalition. So it's been a great collaboration and partnership with the Youth for Youth and Communities That Care.
That's wonderful. Yeah, I was really struck when we came across your work at Broomfield Youth for Youth about, just how youth-led the process is and how many partners you've been able to bring in. And we do want to hear a little bit more about the partners that you've worked with. But before that, we have a text chat question because your model is sort of based on the Sources of Strength model. And you've done a really beautiful job at adapting that to a local context. And so we're wondering if the audience has any national models that you've adapted or seen adapted to a local context. And feel free. And as Alicia is pointing out, Sources of Strength is also in the CDC suicide prevention technical package as an evidence-based practice or model. And so we were excited to see your local adaptation and would be curious if other people have similar things to share. But while folks are sharing in the text chat, we'd love to hear a little bit more from you, Aria and Nicole, about who you've worked with across the city and in what ways.
Yes. So we didn't really know what this would look like when we were starting to think about the summer internship back in January. But we feel that by talking to the adults who range from different teachers, staffs in different school districts, or just people and parents too. So what we asked them at the end of the internship is, what was kind of your best part? And a lot of them said it was great that we were able to do this online because it's a whole different kind of situation. A lot of people have busy lives and aren't able to kind of think or stop and take a moment to kind of reflect on these ideals for themselves. So this pandemic gave them the opportunity, as well as the youth members, the opportunity to kind of look at this issue or what we were working towards through a different lens, which was really amazing.
Yeah, I think it's amazing how you've kind of turned that into a positive. Nicole, were you going to add to that?
Yeah, I just wanted to, talk a little bit more about the internship that Aria is referring to. So again, when COVID hit, we weren't sure how to make this Youth for Youth internship work. This is our third summer of doing a more intensive program with the youth where we have a focused project. So this year, because of everything going on, we really thought that idea of connectivity and building resilience, again, was something we wanted our community to focus on. So that's when we partnered with Sources of Strength. And it is a national evidence-based program. We were all trained, the youth were all trained by a regional trainer in Sources of Strength, and we partnered with adults in our community. So again, we brought in a lot of partnerships too, and they were also trained. And we held weekly meetings, all virtual. And it was a very, very youth-led. So we would have the youth lead these conversations about various sources information. So, and just to backtrack a little bit, Sources is really, it's a comprehensive wellness and resiliency building program. And so we really wanted to help empower our community and young people and adults. How do you develop your support systems and how do you lean into your strengths? So it's a very positive messaging tool that we used. And so the youth lead these conversations every week through the summer. And it really just, again, trying to create those conversations where we're normalizing a lot of these topics and mental health issues. Yeah, it was a success. I mean, the partners, our adult partners really, I think, absolutely loved going to Zoom meetings that were youth led is something a little bit different. And the skills and opportunity, the skills that we saw the youth grow in through the summer were really incredible. So even just facilitating breakout rooms and giving them opportunities to really lean into some of these skills was a really great experience.
Wonderful. And yeah, I noticed that sort of a theme that's coming up both with what Elizabeth said earlier and what you both have said just now is really the importance of a strength-based approach. I'd love for you to say, a little bit about the What Helps Me campaign that we have up here that was was this part of your work this summer?
Yeah.
Mm-hmm. You can talk about that, Arya, if you'd like.
Okay. So the What Helps Me campaign was kind of what we thought of throughout the summer. We were trying to brainstorm ideas. So we started off with like finding the issue and then brainstorming different like kind of things or like risk factors and push factors towards that issue. And then from there, we realized that a lot of people don't realize that other people are in the same boat as them. So what we wanted to do was we wanted to create this video and start this campaign where we show people who are suffering through these things that there are other people there that have gone through this and that are there for them, and kind of also give them like a resource, what helps them when they're going through these things, so that even if they don't want to talk and come out and say something, they at least know some of the things that have helped others who have also been in their same boat, which is what we really wanted to do with this video. So all the youth members and the adult members came together and we created this video about what helps us when we're stressed, have anxiety or sad or mad, and in different situations like that.
That's awesome. And really, I think is so needed during the pandemic when we need to feel sort of connected to each other and hopeful and in solidarity. So thank you for sharing about that work. I think, Alicia, I'm going to hand it over to you to wrap up with our last panelist, but Arya and Nicole, thank you, and we'll be back with you for the joint Q&A.
Thank you.
Thanks, Alexis. And just to share what's been coming up in the chat with regard to the last question about national models that have been adapted locally. I saw some things on the Zoom chat around youth mentors, Hope Squad, which is another evidence-informed program focused on school-based norms change and coping skills. And Ruben, maybe if you can share in the chat a link to Hope Squad, that would be great. People also mentioned hotlines, making use of SAMHSA's suicide prevention toolkit. And then on Facebook Live, we're also streaming on Facebook Live right now. We had a comment around teaching and using the strategic prevention framework with students and coalitions for challenges that they're seeing in their communities. So lots of different ways that people are thinking about adapting national models. And with that, I would like to introduce our final guest, our final panelist, Dr. Nia Westbay from CLASP, which is the Center for Law and Social Policy. And Nia, I'm wondering if you could start off by just telling us a little bit about CLASP.
Sure. Hi, everyone. And thank you all so much for having me today. It's been great to be able to hear everybody else already so that I could just do all kinds of tie-ins. So CLASP, or the Center for Law and Social Policy, is a nonprofit anti-poverty advocacy organization located in Washington, D.C. We do advocacy at the federal, state, and local levels across a range of issues impacting the lives of people living in poverty in this country. We do our work in 6 main policy teams. We have an income and work supports team that is focused on many of the public benefits that people might be familiar with. We have a job quality team that does work on issues like paid family medical leave, fair scheduling. labor standards enforcement. We have a team that is focused on childcare and early childhood education. We have a team that's focused on post-secondary education and workforce development. We have a newer team that's focused on immigration and immigrant families. And then we have the youth team, which is where I sit. Our team is a little bit unique at CLASP in that we're the only one that's really focused on a population. So a lot of our work cuts across many of the other areas that I already mentioned. And we really, across CLASP, and especially in the youth team, are doing our work with a very intentional racial equity lens and really thinking about how we can use our policy efforts to achieve greater equity.
Thanks, Mia. And you recently co-authored a report called 10 Core Competencies for Youth and Young Adult-Centered Mental Health Systems. And I'm wondering if you could share a little bit about that and themes in the report that might be relevant to a public health approach to youth mental health. And yeah.
Sure. So I always start out presentations where I'm talking about this report where I say, even though it says mental health systems in the title, the core competencies that we talk about in this report are really for anyone who is working with young people and is interested in supporting their mental health and well-being. So there's going to be a lot of themes that I'm going to talk about from the report that are going to echo things that we've heard throughout the conversation. Like I said, that's the benefit of going last. But if you go to the next slide, Alicia, one of the things that we really wanted to role model as we developed this report was doing it in partnership with young people and in partnership with their expertise. So I'm going to share with you all really quickly a poem that one of the young people that we collaborated on this report wrote that I think really speaks to a lot of the issues that we're talking about today. There's two here, but I'll just read one, which is, I haven't been heard because my words are sharp, shards from a broken heart. I retain this pain. No one can bear it but me. So I hide behind eyes that conceal my true self. I can hardly carry this weight, so I never bother asking for help. And we got this poem from a young person when we went out to sort of solicit feedback on this list of core competencies that we developed, and in response to sort of what it meant, what were the things that young people were carrying that they needed to have responded to and have responded to more effectively. And this was a piece that came out of that work. So we used several strategies to get young people to provide their input on this report. Artistic expression was one example. We also had young people, I saw somebody mention in the chat photo voice. So we also had young people do some photo voice work on this project, as well as a series of sort of facilitated activities where we had young people write responses to different competencies and share their thinking. So that brought us to the competencies, which I can share. And like I said, lots of echoes of what we've already heard from many of the other panelists today. We came up with 10 core competencies total. 6 of them are really focused on how to do the work. So there are things like being trauma informed in our practice and healing centered, to use the language that somebody else already mentioned. Having a positive youth development focus, which speaks to a lot of the asset-based framing and some of the other things that people were talking about earlier. Making sure that your setting is youth friendly. So that might mean, I just did a training for a group of young people from 7 to 9 last night. Was it because I love working from 7 to 9? No, but that's because that's what time the young people were available. And if you really want to be able to have young people engage effectively with your setting, you've got to think about things like your hours, your availability during non-standard hours and on weekends and that sort of thing to make sure that young people can actually access your services. Having a disability awareness lens and really thinking about how we work with young people who have a disability to become advocates for themselves and for their community, and how that all ties into their mental health. Cultural responsiveness, another theme that we've already heard about throughout the course of this conversation. And that means both people's culture that's derived from their heritage, as well as youth culture. You know, young people are constantly evolving, but all young people have culture. And this, you know, current young people today are very interested in technology, very tech savvy, using social media, all those sorts of things that are deeply embedded in their culture. And we, as the more seasoned folks who want to connect with them, really need to be thinking about how we can do that. And then finally, the one that I led with and that this panel led with, which I love, is authentic youth engagement and really drawing on young people's expertise and leadership. as you're thinking about this work. And then there were 4 content pieces that we also talked about as well. Part of why we're here, we love the work of the Prevention Institute so much, is because of your focus on prevention and trying to get upstream and do things that are effective for young people before we get to a crisis situation. So that we think is really important to be thinking about in the work. Addressing the social determinants of health. So these are community conditions, these are things about economic factors, education, all the different sectors that we've been talking about today, and how those impact young people's mental health. Thinking about integrating physical and behavioral health, and how we can bring those things together into a holistic understanding of what it means to be healthy and well, and how we can make it easy for young people to access those services together when they need them. And then finally, again, related to the point about asset-based framing that someone else talked about earlier, it's not just about what we don't want young people to be, it's what we want them to be. And that's what we call wellness, and how really, quite frankly, how young people lead when they talk about mental health. So we really want to, in our work, be very intentional about not just thinking about what we're trying to avoid, but also what we're trying to support young people to become.
That's a great overview. And I love the thought to both the how and the what, because I think often, especially the how can get lost. And especially during a time like this, where the what maybe remains more consistent, but the how is really, these themes remain consistent, but the how to actually achieve them is really changing in the COVID context and during this time. I'm wondering, Mia, if, I know you do a lot of work that's focused on policy, and I'm wondering, what are some changes we need in the longer term to support youth well-being? And what role can local government play in this?
I love this question. And I was thinking so hard about, okay, if I could narrow it down to maybe 3 things, what would be the 3 things that I said? So I think the first one, again, is going to be echoes of the conversation and all the things that I just said, is really authentically engaging young people and their expertise in your policy and systems change efforts. And that means resourcing young people's engagement, authentic engagement and expertise. And I mean resource in a couple of different ways. It's both in how you set up your engagements so that young people can actually attend. That's everything from the time to thinking about childcare. Again, in the training I had last night, some young people had their kids with them. And you know what? That was fine, because we wanted them to be there, and you sort of have to be open to those kinds of things. Providing food, providing stipends, paying young people for their time in the same ways you pay for other types of expertise. People have no problem paying all kinds of consultants hundreds of dollars an hour for their sort of formal training, but then when it comes to young people, want to sort of not meet the same standard in terms of how they're supporting young people. So I think there really needs to be a lot of work, and this can come from state and local governments. A lot of them have built out advisory structures, youth advisory councils, youth coordinator positions. There's sort of lots of ways to do it, but making sure there's consistent and ongoing engagement with young people as leaders and experts who are providing feedback on how changes are proposed, how policies are changed, how things are developed. I think the second thing that I would like to see happen over the long term is, to this point, the points that people have already made about sort of a mental health in all approach. What you hear from young people is that for different young people, different spaces are the safe spaces where they feel like they can get support. So yes, schools, but also after school programs, but also maybe the barbershop and the beauty salon, maybe also a religious institution, maybe also Parks and Rec. All of those places that are receiving young people need to sort of have a baseline level of skill, so that when a young person is going through something, experiencing a crisis, going through a challenge, that they sort of feel prepared to give that young person some support, as well as then help them connect to the next set of resources or whatever additional resources that young person might need. So definitely thinking about across a wide range of settings, which is why, again, I said these core competencies are for anybody who cares about young people. We really want to make sure that we can embrace and support young people with some understanding of sort of like a basic baseline understanding of how to address mental health issues. And then the third piece that, again, I think is such the valuable lens that Prevention Institute brings to this work is a real focus on prevention. And again, investing and resourcing in it. I think I shared with you all on the prep call for this. A friend of mine had posted something for Suicide Prevention Month on Facebook that basically said that affordable housing is suicide prevention, that fair living wage is suicide prevention, that economic justice is suicide prevention, that universal health care is suicide prevention. And all of these things that are so many steps back really lay the groundwork for making sure that young people can be healthy and well in their communities, and that they can access the resources that they need when they need them. So one I know that's really top of mind for folks this week is healthcare. Young people are one of the groups that have gained so much ground in terms of gaining health insurance coverage under the Affordable Care Act. But we still have major gaps in coverage for young adults in this country between 18 and 24, particularly for young people of color, have very high uninsured rates, particularly young men of color. So we really got to be moving towards universal health insurance coverage to make sure that all of our young people sort of, again, that cost is not a barrier to them being able to access the services that they need. So I'll stop there for now, but definitely thinking about authentic youth engagement, thinking about mental health in all approaches, and then really amping up that prevention lens at multiple levels is really critical. Because again, in my work, I've gotten to talk to young people all around the country around mental health. And there was so much frustration from young people where maybe there had been a suicide in their school or in their community, and then resources came. And what they said was, why is this the first time that we're hearing anything about mental health? Why is this stuff coming in on the tail end when we needed this stuff long before?
Thank you, Nia. Yeah, lots of agreement in the chat right now. And it's really bringing me back to the introduction when we first asked people about what's coming up right now. And the things that people mentioned really connected to these social determinants of health and things like housing and living wages and, things like isolation and things that, Prevention Institute calls community determinants of health. So this mental health and all frame is really helpful in thinking about well-being for young people and families and communities as a whole. So lots of agreement in the chat, and thank you all for joining in on the conversation. Please feel free to keep sharing there. And if anyone has any questions for any of our panelists, please also drop that into the chat. I want to go to our next slide and just invite all of our panelists back into the conversation and just see from what Nia just shared at the end, because I feel like some of those points that you were making, Nia, when it came to strengths-based lens or compensation of young people, it really connected to other panelists. So just want to open it up and see if any of our panelists want to share anything that came up for you when Nia was just speaking.
I definitely can speak on that. When Nia was speaking, it was honestly just so encouraging. And thank you so much for your work as a young person, seeing someone support us and believe in authentic youth engagement and provide us with opportunities. It just means so much. And I am so excited for the future.
Thanks, Gianna. Anyone else?
Yeah, I definitely.
Sorry, go ahead.
Yeah, okay, thank you. Yeah, I definitely agree. Like, it's so good. It's so encouraging to see that people are kind of noticing our work and like how we can make that change in the community. And it's amazing that that just kind of drives us, or drives me more, because I know now that people are like they're like voting for or like supporting us in that way. And I really thank you for your work.
Well, that's mutual. I thank you all for your work.
Exactly.
Because again, you get better solutions when you listen to young people. They're the ones who are talking about things like, we're talking about telehealth long before the pandemic. They were like, we need to be able to access services through text and apps. They've been saying that for a long time. They're the ones that are saying things like, we need peers, we need support from peers, from people like us with shared experiences. They've been saying that forever, so you get to better solutions and different solutions when you listen to the folks who know the most about the issue.
Definitely. And we did have one question coming up for you, Mia, about if you could just speak a little bit more about disability awareness and that competency.
Sure. Yeah, I think that was an interesting one for us to learn about with young people, because I think there's a balance between young people recognizing sort of real instances of discrimination that folks experience when they have a disability, but also understanding that that can be a positive part of someone's identity as well, and wanting to be able to support that as a positive piece of their identity development. And on top of that, a real need to sort of have an understanding of sort of laws and rights and the civil rights issues around disability, so that young people can really get access to the supports that they need and can really get the services that they're entitled to under the law. So I know that the link to the report was dropped in the chat, and if folks want to check that out, there's definitely some more detail in there about that issue in particular, and sort of young people's take, as well as what it takes to be competent as providers in that space, but also happy to answer more questions and follow up.
We also have a question around what types of resources help people move forward with authentic youth engagement if that hasn't been part of their organizational culture before? How can they really start doing that? And this is open to all the guests. Would especially love to hear from the young people as well, like for groups that haven't done it before, any resources that come to mind or any recommendations on how to start.
I would probably say that it's more about just knowing that other people are also there, kind of like, even just like kind of one person, you only need one person to believe in you to make that difference, because with one person, you connect out, you'll get more people. And it's just about also knowing that like people are always there to support you. You just have to just believe in yourself and put it out there.
Yeah, for sure. Echoing that, I feel like something that's really important when trying to create service projects or things like that, when youth are trying to get involved, I feel like youth adult partnerships has helped tremendously in the process. Having strong youth adult partnerships is extremely important. I know without the support from our city council, our local businesses, or anything like that, the things we do within our community wouldn't be possible whatsoever. So I feel like getting strong youth adult partnerships and making sure you have that connection is definitely very important.
I agree.
And
oh, can I just add something quickly about, so something in our community in Broomfield that we've been really rolling out and pushing and just had so much positive feedback is positive youth development training. We have a few regional trainers in our area, some community partners, and really working with adults on how to have that authentic youth engagement. You know, I think it can come natural for some people and not for others. And so just helping them with that intentional approach. And we've seen just in the city of Broomfield, we now have youth on all of the advisory boards. And so we've done some virtual trainings to work with all of the adults on those committees, so that when you bring a youth in to a meeting, a board meeting, it is authentic youth engagement. And that's where we're really seeing such a positive impact. So it's very exciting to have so many, members of our community that are open to learning about positive youth development. It is one of our strategies for communities that care as well. So it's something we've been rolling out and really pushing, and just excited that Broomfield is embracing that and really seeing the change from that.
And I'll just add one more thought, because I know there was talk in the chat about circulating a resource list. There are actually some really good self-evaluation tools out there for organizations, because I think Nicole is absolutely right. There is some work that the more seasoned professionals have to do to prepare themselves to receive young people's leadership in a way that is going to be the best experience possible for those young people, right? And there are some great tools out there where an organization can sort of take a look at their existing policies, practices, approaches, what have you, to sort of see where they are in terms of their readiness to receive that leadership, so that you can, sort of what work you have to do, so that, young people don't have to have bad experiences on the back of you trying to get yourselves together.
I'm going to tie two questions together here. And I think we've already kind of been talking about this, but one question around how do we engage in youth partnerships during COVID? And added to that, how do we make sure that young people from all backgrounds and communities are being engaged?
I'd probably say, at least from my experience with the summer internship, I'd say it's a lot easier now to engage youth because a lot of them, like a lot of activities are canceled, schools more from home now. So they have a lot more time to kind of get on these meetings or calls like Zoom or Google Meet and talk with adults about these issues. I think the biggest thing is just reaching out, and then it probably would respond, or youth would probably be open to it because they have a lot more time now on their hands. And as for kind of the diversity aspect or ensuring all backgrounds and communities are engaged, I feel like that comes over time. It's a lot about making sure like these people are comfortable about talking out or joining these groups and sharing their experiences, which would lead to more of that diversity.
Yeah, and I'll just add on the sort of making sure that a variety of young people are participating. That does take some intentionality, but I've yet to meet the young person anywhere in the country from any background who has said, I don't want to share my opinion with you. I don't want to be listened to. I don't want to be heard. I really, and we've talked to young people who are out of school, out of work, in rural communities and urban communities. A lot of young people that maybe folks would think are not interested in engaging or, don't want to be advocates or don't want to lead. And what I'm saying is I haven't found that young person yet. So I think it's really about being intentional in your outreach, intentional in your partnership, figuring out who in your community already has relationships with those young people that you're having trouble reaching, taking stock of who you have and who you don't have, so that you can, again, do different, more intentional outreach to other groups that maybe you're not reaching. And again, invite young people to be partners with you in figuring all of that out, because their sort of sign off or their positive word about your work or their connections are really going to be your best entree into other groups of young people.
I think one thing I would add to that, totally agree, is that adults also should be open and flexible to the way that students want to show up and allow like different norms of communication or engagement and allowing students to dictate the terms. Sometimes we can be like hierarchical even when we've invited students in, and it's not about like having them join into something we're planning, but actually yielding power for them to co-create and own and lead it. And we've experienced success in like capturing a wider net of young people when we remove our preconceived notions of how people show up and what type of student or contributions look like.
All very important points. Thank you all for being open to these questions from our participants today or from our audience. I do want to make sure that each of our panelists has an opportunity to answer one more question just around like, what are some of the teachings of this moment in relation to youth well-being? And what do you want local government leaders to think about in better supporting youth mental well-being in the long term? Nicole, were you going to start off? Your box lit up.
Oh, okay. I'm happy to start. So, yeah, I would say, thinking about how local government for us and what I would suggest is just, continue seeking the funds, the funding for community-based programs. Again, I've mentioned communities that care a few times because it's been so valuable to us to have that as the foundation where we can incorporate I mentioned earlier, have this youth for youth internship where we can compensate them for their time and partner with community members. So because it's been said over and over today that it's going to take everybody in the community to really make an impact and help our youth. So I think that, seeking grants and funding for those community-based programs would be one suggestion I would have.
I would like to, that was a great point, Nicole. I really think a lot about the health in all approach to policies. I think it's really important for us to start to use that lens to really inform the decisions we're making on this macro level, right? We know it trickles down and it's affecting our young people. And so really taking that into consideration, we know there's different aspects of health, but really that health in all, and really understanding that, mental health is inextricably connected to how kids learn. And, I use the word kids very loosely. I mean, youth, young people, young adults learn and perform, and really how they engage with their education. And that doesn't matter what setting. I'm not necessarily talking about a traditional setting, right? But in any time that they're engaging and they're really formulating their identities and their thoughts about life and the world and how they want to function, it's important that we're giving them fertile ground for that. And so many of us have talked about social determinants of health, which we know is huge, right? I think I love the quote from Dr. Nia about it's everything, right? Housing's important, your environment's important, whether you're, how you interact with law enforcement is important, right? I know that's not a traditional form or identified as a determinant of health, but all of those things are extremely impactful. I think for me right now, what I'm learning from this time is the importance of being community and culturally responsive, right? And we're not just talking about race, we're going into just how you identify your social group, whether it's generationally, your interests, your faith, and just really understanding that a lot of the information and services that we're providing to communities, are we ensuring that they're culturally responsive? And that they really address and they take into account the inequities that exist across the board, right? So I think making sure that, as providers, we're sitting back and we're really observing and learning and taking advantage of the richness of our communities, no matter what the makeup is, to ensure that we're being culturally responsive.
Yeah, I completely agree with what's been said. I also believe that all elected officials should invite youth to the table on all subjects that impact them. It would mean a lot if they gave us the opportunity that Nia was talking about. If you gave the opportunity to the young people, I am almost positive they would take them and grab them. And when I say invite them to the table, I don't just mean to tokenize them as their youth representative. I mean to completely embrace their opinion and make sure that their voice is being heard. Someone once said, if you invite the bear to the table or to the party and the bear wants to dance, you better be ready to dance. So I think if you invite the youth, you should really be ready to hear what they have to say.
That's a great quote. Love it.
So I'll add that, so in our work, we've talked quite a bit about historical and cultural trauma, which is sort of the ways in which the past or sort of shared traumas in the present affect us now. And in terms of the pandemic, I've really been talking about how we are living the cultural trauma of a generation right now, right? And the pandemic has really both brought to light long-standing challenges and disparities with a long history, and at the same time has has given us a common experience that we are all going through right now and having to deal with in different ways. That I appreciated the work that's happening in the New York City schools, because young people are experiencing the anxiety and the challenge and the grief and the loss and the anxiety of this moment, just like all the rest of us are, right? And so we really have an opportunity to take this moment to look at what we had that was already inadequate and figure out how can we make it better to meet this moment and to meet the future, so that the cultural trauma that we're experiencing now doesn't become a historical trauma for several generations into the future. So I would emphasize to state and local government officials that your work right now is really important. The decisions that you're making and the investments that you're making and the responses that you're having are really, really critical right now. And that they really have to be made with this understanding of the moment that we're living in and the history that it carries.
I agree with everything that's been said by all the panelists. And I just want to add, it's also about just being open to that new perspective that the young people have, that a lot of people don't see because they don't experience the same things and they didn't live in the same time when they were at that age. A lot of things have changed, and it's really important to get that perspective to make like the most detailed and informed decisions.
I agree with that and with what others have shared. I think I would build on that, maybe land with a recommendation that kind of connects to the work we're trying to do with students, which is that like as city and local governments or state governments interact with school districts or CBO partners, that everyone like uplifts the same commitment to community and relationships with one another that we do in our work with young people. And I say that because I think sometimes like bureaucracy, or especially in large systems or titles, like things can cloud the core vision of the work. And like when we strip all of that back, often there really are common goals. I think it's a matter of centering ourselves on like, what are we trying to accomplish? How are we respecting what other parties are bringing to the table? And how can we remain like committed as partners and really try to leverage, you know, interagency collaboration on behalf of young people, and just trying to stay grounded in that and in our own humanity and like the why we're all doing the work, I think can yield the most successful outcomes.
Thank you all. Those were all amazing recommendations and themes that have been coming up, and so many similarities across our guests that are coming from very different geographies, different types of agencies or organizations. And yeah, really appreciate all of that. And if you are on Zoom right now, feel free to use your reactions. And I'm going to give a clap to our participants today. And I'd like to go to our next slide. And for all of you joining us, whether you're on Facebook Live or Zoom, please share in the chat what would be most helpful to you in terms of next steps. So many themes have come up today, and part of what we want to do is support you in taking action. So please do share in the chat what would be most helpful for you in your next steps. And I'm seeing things around resource and tools list. That's definitely going to be on our to-do list. We will follow up with everyone with that. And if we go to our next slide, the slide deck is available on our website as a PDF as well. And we do also want to share the suicide prevention lifeline link. So if you need help, you know someone who does, wanted to make sure that that was available. And do we have our resources slide? So we have a bunch of resources slides as well, which again are going to be available on the PDF. And just to quickly run through what we have. So again, the CDC technical packages are a great resource of strategies and approaches to consider. And on our next slide, we have a reminder about the NLC City Summit that's coming up. Also today, we had Elizabeth share about the Bridge to School plan, which is a great toolkit available to everyone as a PDF as well. We had Broomfield Youth for Youth share some information, and we have links to these as well that we'll be sending out. Mental Health America Houston has a bunch of resources as well, the Emotional Backpack Project, and also Mental Health America has a back to school toolkit as well. And then finally, the Center for Law and Social Policy, we talked about the 10 core competencies, and you can access that. And that's our final slide, I think. So yeah, thank you all for joining. Again, feel free to share in the chat anything that will be helpful as a next step. We really appreciate you joining us today, and we will be sharing a recording if you want to send this to anyone else. And we will be doing more webinars and more activities, creating tools and that sort of thing. So looking forward to sharing that with all of you. Thank you again for joining. This concludes our webinar.